Well, we are almost to the end of our symposium. And for those who have not had a chance to be with us in the morning time, we're going to have a quick wrap up, 10 little minutes, by our first year resident, Dr. Anisha Bhanot. And she's going to just quickly go through all of our presenters' talks and give you just highlights for you to remember. So I'll have Dr. Bhanot take it away.
Thank you so much, Dr. Allen. I am going to share my screen. Okay. Are you able to see my screen in presenter mode?
Yes, very good.
Okay, perfect. So thank you so much to Dr. Allen. We will go ahead with our 2024 Skin of Color Symposium wrap up. So we had a list of great speakers today and some very informative talks. Our first speaker of the day was Dr. Fermi Ogunlami, who talked about disabusing disability, demonstrating that disability does not mean inability. Some highlights from his presentation include the differences between equity, equality, and reality. So equality, he stressed the point that equality is providing individuals with equal resources versus equity is providing individuals with resources in regards to their need. Reality, on the other hand, is the thought that each individual has an unequal allocation of resources. And Dr. Ogunlami's really stressed the point that access is different for each individual, and each of us should recognize the spaces and places where we can provide access to individuals of need. Our second presenter of the day was Dr. Lauren Krieger, who spoke about recognizing and managing disorders in curly hair. She talked about the unique properties of curly hair, and some highlights from her presentation included that hair shape is actually defined at the follicle, and proteins are expressed in an asymmetrical pattern in curly hair. The increased risk of mechanical strain is due to the curvature in curly hair, which leads to weak points. And overall, you see a less dense cuticle in African hair. She also talked about the different types of hair loss, specifically in the African-American hair population. We touched base on alopecia areata, and she spoke how there's an increased likelihood in Black patients, and hair loss tends to be more persistent and seen in the more severe forms. We talked about androgenetic alopecia and how miniaturization in curly hair types specifically presents with different texture. We also spoke about mimickers such as fibrosing alopecia and pattern distribution and how that has features of AGA and an overlap with LPP with significant perifollicular erythema and scaling. And lastly, we also talked about frontal fibrosing alopecia and other key manifestations, including hyperpigmentation, facial papules, and loss of eyebrow hair. Dr. Krieger also talked about CCCA and how the understanding of this disease has changed over time, and how newer studies suggest a genetic component with the PADI3 mutation, as well as the strong genetic predisposition and environmental triggers. She also touched base on how there is no clear evidence that chemical relaxers are tied to CCCA, and how we can consider concomitant hair disorders and more recalcitrant diseases. Our third presenter of the day was Dr. Clint Peebles, who talked about sexual and gender diversity and considerations for equity and inclusion in a changing landscape. This is a diagram from his presentation where he talks about how sex assigned at birth is not equivalent to gender identity, which in turn is not equivalent to gender expression, and not equivalent to sexual orientation, and overall not equivalent to sexual behavior, and that it's important to understand these terms and the nuances as well. He further spoke on how there's a great racial and ethnically diverse population of gender diverse individuals, and how many of these individuals experience discrimination in the healthcare field, and that's why they turn there are less overall people seeking medical care. He also touched base on the efforts in the country to marginalize gender and sexually diverse people through bills and legislation being passed, and how overall us as healthcare professionals, what we can do to further help these individuals get more access to care. And that starts with being educated about how we can help. Our fourth presenter of the day was Dr. Sean Quatra, and he addressed the racial disparities in itch. Some key highlights from his presentation included itch and atopic dermatitis, where he spoke that there are properties of Black skin that contribute to itch, which include larger mast cells, increased microflora. He also spoke about how Black children are 6 times more likely to have persistent atopic dermatitis, and they end up with a greater cost of care in hospitalization. We talked about differences in presentation of atopic dermatitis of skin of color, like lichenification, perifollicular involvement, hypo or hyperpigmentation, which can later lead to a delay in diagnosis and appropriate therapy. And also spoke about the adopted Hanifin and Rajka criteria, which takes into account to the unique features seen in skin of color. Dr. Quatra also spoke about prurigo nodularis and how Black patients tend to have larger, more fibrotic nodules that tend to be less responsive to therapy. And we also touched base on the promising therapies such as JAK inhibitors and nemolizumab. Our fifth presenter for the day was Dr. Oma Abai, who spoke about cosmetic procedures in skin of color. She discussed that almost 32% of cosmetic patients are people of color, and further discussed cosmetic options for patients with certain concerns, such as Botox and fillers, laser hair reduction, laser therapy for acne scarring, and chemical peels. She also talked about the side effects of each of these cosmetic options. 2 pearls that I thought were very helpful in her talk was that soft tissue augmentation in people of color with poly-L-lactic acid has been shown to show minimal bruising and risk of hyperpigmentation, as well as longer results. And another pearl was that radiofrequency, which involves skin tightening and fat reduction, is unlikely to cause dyschromia in people of color due to the penetration of energy in the deep dermis. However, that being said, we did talk about that important precautions should always be taken in patients with skin of color due to the risk of dyschromia. And we can always pre-treat with fade cream to decrease this risk. Our next presentation of the day was Management of Acne and Rosacea Skin of Color by Dr. Fran Cook Bolden. She talked about the specific skin of color presentations and provided great photographs for these clinical manifestations. The skin of color presentations include pomade, acne cosmetica, acne excoriae, steroid-induced post-inflammatory hyperpigmentation, and keloidal acne. She further talked about treatment, which included oral and topical antibiotics, the use of sunscreen, retinoids, and specifically recommended azelaic acid with a 2 to 4 week course of low potency corticosteroids, acids such as glycolic acid, hydroquinone, and other treatments as well. And she stressed the importance of the goal to treat acne early and prevent PIH. She also spoke about rosacea and the clinical manifestations in patients with skin of color, some of which include the erythematotelangiectatic, papulopustular, phymatous, ocular, and granulomatous subtypes, with the granulomatous subtype being the most common. She also spoke about treatment options for rosacea, which include topical and oral antibiotics, laser therapy, sun protection, and to avoid triggers, and also stressed the importance in diagnosing patients and treating them early on. And then that brings me to our last presenter of the day, Dr. Kanya Ferguson, who talked about dermatologic oncology and skin of color. She presented the cutaneous malignancies in skin of color can be quite difficult to diagnose due to the wide array of characteristics differing from the Caucasian population. She talked about how basal cell carcinoma may present with globules of blue and black color with still that pearly appearance and rolled borders, and how the telangiectasia can be less visible. She also discussed how squamous cell carcinoma has also another wide array of clinical manifestations and can present with an ulcerated plaque with surrounding hypo or hyper or pigmentation and even a violaceous hue. And also spoke about how melanoma can present with large multivariegated lesion with atypical lesions as well, and how the acral melanoma is difficult to diagnose, and how these usually arise in patients of skin of color in the non-exposed areas. Dr. Ferguson spoke about the morbidity and mortality trends and how those are higher in people of color, and also touched base on the factors contributing to disparity, which include late diagnosis due to the differing characteristics, access to healthcare, and the underrepresentation of people of color in our clinical trials. And with that, I'd like to give a big thank you to everyone who spoke today. We had some great presentations, and thank you to everyone here, and also Dr. Allen and Ms. Renee for organizing this event.
Thank you for that wonderful wrap up. Just to keep us in mind of all the things that we've learned today. And just to conclude, I want to say a big thank you to our Mark Allen Everett, MD, Skin of Color Symposium Planning Committee. This has been a year-long in the making, and the committee of people from students, residents, and all of the people within the CME office and assistants here in the Department of Dermatology. I appreciate their dedication behind the scenes, providing advisory and technical support to produce such an exceptional educational program. I want to thank the residents who have been on duty today, monitoring the chat, as well as the registration opening this morning. But also, I want to thank you, the attendees, for being here, and hopefully you have gained knowledge of so many different aspects of skin of color, health disparities, and where we can improve on our access of care for all. And so with that, I just want to share one quick slide, and that is, let's see if I can get it up. And that is for our next program, Save the Date. The date is Friday, May 9th, 2025. And we will see another special lineup of speakers next year. And we hope that you will tell others as well about our program that we offer for everyone. And for those who are wanting credit, CME credit, ANCC credit, please be sure at the end of this program to complete the evaluation and give us feedback on other topics and things that you enjoyed or would like to see improvements on. So we thank you, and we are adjourned. Take care and have a wonderful weekend.